You are watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, no more dentures. According to my first guest, in one day, you can go in with a denture and leave with a fixed set of teeth. With us, we have Chicago's dental implant dentist, Dr. Atcha. Dr. Atcha, welcome to the program.
Thank you, Randy. Thank you for having me here.
Now, we've had you on, what, 2 or 3 years ago?
That's right, Randy.
And, you know, we talked on the phone, and I've been trying to get you down here again for another interview. But what's changed since then?
Randy, a lot has changed. What used to take us months and months, and it can literally be accomplished in days. Cases that we thought that were hard to treat, now we're treating them, and we're treating them with amazing success rates. So, I mean, a lot has changed.
Why is it what used to take maybe 9 months or so now happens in a visit or two?
Well, Randy, that's a great question. Before, we used to have, if patients lost teeth or patients have lost teeth in the back part of the mouth, patients used to have go through bone augmentation or bone transplants. But now, with the technology, with 3D technology that we have in our office, we can literally see where patients' available bone is. And for almost everybody is a good candidate, even if either they have dentures or even if they have teeth that are going to be removed. We can perform the surgery, which is placing the implants, and we angle the implants so we avoid any kind of structures like sinuses or nerves. And the implants go in snug. When they go in snug, we're able to put teeth on immediately, and it's literally all within.
What about pain, though? It seems very painful. I've told you this.
Well, yes, I know you have, but and patients ask me that question, but
is that their number one fear?
That is the number one pain.
What do you
say? And say, you know what? The most patients, when they have this done, they have to take either an Advil or Tylenol the next day. And we're talking about full oral rehabilitation. We're talking about having implants in top and bottom jaw. The reason why, Randy, is that the bone doesn't have any nerve endings.
Okay.
So, and we do a lot of things to do for pain management and sedation, and that's also a big part of why our patients are very comfortable the next day and thereafter.
Okay. Now that big collage, your mother's in that collage. Let me see that collage. Now this is good. So these are just some of the patients that have taken advantage of. It's like Dr. Atcha's class of 2012 or whatever, or 13.
Yes.
So you've even done this on your mother?
I have. So when we say, you know what, because I believe in what I do, and
so she had a denture.
She had an upper partial, and she had a lower denture, and she was one of those. She just said, I could live with this.
Okay, and by the way, if you're just tuning in, we're talking with Chicago's dental implant dentist, Dr. Atcha, and he says no more dentures. Get a fixed set of teeth in the same day, or if you've been told your teeth have to go, you don't have to wear dentures. So let's talk about that. Okay, so this first one. Wow.
So here's a woman that comes in and seeking our help. So how old do you think she is, Randy?
This looks like an older, 60s.
Okay, well,
70s.
This woman is actually in her late 20s, Randy. Because if you see her after, it's gonna blow your mind. You're gonna see how beautiful her smile looks.
So what's going on there when you see that? When she comes in, what does she say?
There's a lot going on. She said, I can't eat. My teeth hurt, and I don't want to end up with dentures. I'm too young. I can't. I'm too young. I have a whole life ahead of me.
That has to be unusual, though, because that looks pretty bad.
It's not unusual. You see them everywhere. The reason why they don't smile is because they're not happy with their smile. But there are patients like her everywhere.
So when you hear this woman, okay, so she's got a lot of problems going on.
Her symptoms were bad teeth, decayed teeth, bad breath, periodontal disease, gum and bone disease, and just painful mouth from just teeth that are broken down like rotten apples. I mean, that's how bad those teeth are broken down. In one appointment, we removed the bad teeth. We put the implants in, and when she left the office, she left with the office with fixed set of teeth, and she was smiling from ear to ear. Okay. And when I show you what she looked like, it's going to be amazing.
Very nice. That is a big difference. That's a beautiful smile right there.
She's absolutely gorgeous. She's absolutely gorgeous.
So before, she just didn't smile.
Before she didn't smile. Before she wouldn't open her mouth. Before she was very fearful. Before she was not a happy person. Now, it's just that when she walks into a room, the whole room lights up.
And how many implants? I mean, how many dental implants to accomplish this?
It took 4 implants on the upper jaw, and it took 4 implants on the lower jaw.
And you give them a full arch of teeth?
Full arch of teeth.
Okay.
Full arch of teeth. And it's amazing what it did for her. She came in because she wanted to have no pain, and she wanted to be able to chew, and she wanted to be able to smile. But look at the cosmetic aspect of her smile. She has a smile from ear to ear. I mean, if you look at her, the smile is so natural that it follows the lip line. When she smiles, you see.
So her teeth just kind of follow.
Her teeth just follows the smile line. And she's at a very normal lip, normal smile line, normal midline, and it's proportionate. The teeth are proportionate to her face, to her upper face, to her mid face, and to her lower face.
She's typical, though. I mean, there's a lot of people out there.
There
same situation.
are hundreds and thousands of people that are out there like that. I mean, you look at this gentleman right here.
Okay.
Look at this gentleman.
Oh boy.
He comes to us and he told us, you know what, my son's wedding is coming up. I don't want to go to my son's wedding with my 2 buck teeth.
What did you do for him?
Okay, what we did for him exactly what we did for the other patient. We removed the bad teeth. We removed the bad teeth that were decayed, that had gum disease.
What if the gums are too bad though? Can they still get dental implants?
Absolutely, Randy. It's a misconception that people think that they have bad gums, they can't have implants. But when you remove the teeth and when you clean out the infection, guess what? The infection goes away, and the bone is healthy. That's what we're using. We're using patients' own available healthy bone to anchor implants.
And that's got to be unusual though, looking at this guy.
Again, there are so many of him that are walking around every day. You just don't see them is because they don't smile. They don't smile, and they avoid going to the dentist.
All right, let's take a look at his after.
And take a look at his after. Look at his smile. Look at his smile. I mean, he's a very attractive gentleman. He's confident. He looks confident, and he's going to be very happy for his son's wedding.
That's an extreme makeover, right?
It is a complete extreme makeover.
And what does he say when it's all done?
When the results is done, he's like, you know what? I wish I would have done it a lot sooner.
So with him, okay, so he has a fixed set of teeth on the upper,
fixed
and
set
the
of teeth
lower,
and
how many implants? You say that like the all-on-4? Is that what you're calling it?
Absolutely. He had the all-on-4 implants.
So 4 implants on the bottom.
Right.
Get a full arch of teeth.
4 implants on the top, 4 implants on the bottom, and full arch teeth. And you can see that he doesn't have an implant for every tooth, but on 4 implants we supported all his teeth that don't come out.
Now tell me about his eating. Okay, so he can eat what?
He can eat whatever he wants. He can eat. He put off eating hard foods because every time he would eat, a tooth would break. Okay, every time he would eat, he would drink something, it would be sensitive. Now, he can eat corn on the cob. He can bite into a steak. Okay, he can eat nuts. Raw vegetables. I mean, anything. He doesn't have to think twice about ordering what he has to eat from a menu. People are living longer these days, and you have patients in their 60s and 70s going for job interviews. Yeah. So when you look at his smile, I mean, who is he going to be marketable with? With the smile with the bad teeth, or the smile that he has now? I mean, look at him. He looks successful. He
does. You're right. Okay.
He's portraying an aura of confidence. He's going to be more marketable to his.
He looks sophisticated.
Sophisticated, absolutely.
And before, there's no doubt about it, somebody would prejudge.
Somebody would prejudge just based on what he presented with. Absolutely.
He looks healthy.
He looks healthy, and he looks happy.
And so normally a guy like this would have had to get dentures.
Absolutely. And this is what he was told. He was told that his teeth can be saved, and he's going to have to work.
Who tells him this? Who tells him this? Well, that they have to go to dentures.
You know what? Wherever he went to, whoever his dentist was, told him that, you know what, he's not a good candidate for implants because he had bad gums. But he said he was told that he has to live with dentures because implants are too expensive, implants wouldn't work for him, and so forth. But does
that frustrate you a little bit?
It does. It does. It frustrates me, and it frustrates me a lot because I think educating those patients and letting the patients know that they can have this done. They have hope. They have a solution. They don't have to live like this.
Now you remember, we should mention that you're training. You're a general dentist. That you do both the surgical part and then how it's normally done. And correct me if I'm wrong. That normally you go to one dentist that does the surgeon that does the surgery, and then you go to another dentist in another office, and they put the teeth on. You do it a little differently. Elaborate on that.
Absolutely. The traditional model is where you have a dentist and patient wants either a single tooth implant or a full replacement. They're going to send you to another dentist. Okay, it could be an oral surgeon, or it could be a periodontist. And then you come back to the dentist, and then the dentist will place the teeth. They might have to go somewhere else for imaging. We feel that it's an inconvenience for the patient. Patient wants to stay within one office, and we have such success with our cases. Randy, to most patients, what they want to see beautiful teeth. Okay. I don't talk about implants. How am I going to do implants? Where am I going to place implants? I get my patients excited how they're going to look like and what their teeth are going to look like. So I am a very rare.
So you do both. I mean, you do the surgery?
I do both. I do the surgical placement, and I also do the prosthetic, which is placing the teeth. This way, patient's outcome is just much more predictable. I know exactly where the teeth are going to go. I know exactly where the lip line is. I know where all the cosmetic end of things. That helps me do my implant surgery. So there are very few of us that do the surgical placement of implants and also the restorative part of the implants. And that is my passion, because I can do both. It really.
And you've had a lot of training in this. I said at the top of the show, but you've had some training in this.
Absolutely. I mean,
not just a weekend course, as some of my oral surgery buddies said. Randy, some of these guys are taking weekend courses. I mean, how many years have you been studying this?
I have been studying this for the last 10 years. I've been studying, especially implantology with same-day teeth, with immediate implant placement, the all-on-4s, even grafting. I've been studying for the last 10 years. But you can't go to a weekend course and come back on Monday and place implants, because you're really not doing a service to your patients. I mean, you really have to get some further advanced training, get some certification, get some credentialing behind your name, so that way you can help patients. Last time I was here, I know we talked about a lot of the all-on-4s and 4-implant method and fixed teeth. Now, since then, I've been doing what's called zygoma implants. Zygoma implants are the long implants. On those patients, now we're only talking about the upper jaw. Those are the patients that have been wearing dentures for decades, 10 years, 20 years, 30 years. Those are the patients that actually have no jawbone. We call it the no jawbone solution.
Okay.
And what it does is, we're using those special implants, they're called zygoma, or we call it long implants. We are able to put those long implants, they're anchored just right below the cheekbone, and we put 2 to 3 standard implants in the front part of the mouth, and we are able to give them with fixed teeth. And the most important, the most exciting part, they don't have to go through bone grafting. These are the patients that have been told that I need to have multiple bone grafting surgery. I need to have bone taken from my hip. Okay, I need to have a sinus grafting. All those things were fine at one point, but science and research have evolved so much.
But they're still doing those.
But it's still being done.
Sinus lifting procedures.
As we speak, there's probably 2 or 3 or 4 going on right now in Chicago or in other parts of the country.
All right.
What happens is that these patients, these procedures are not minimally invasive. What it does is it's creating second surgical site. It's delaying treatment. And the most important part is that when you do all this advanced bone grafting, patients can't wear teeth. They can't even wear a denture. So who wants to walk around with no teeth? But with
this new technique, not a lot of guys doing that?
It's being done by maybe 1 or 2% of clinicians in the U.S., if not the world. Zygoma implants it's a very specialized technique. It's actually been done it's actually been done for many years. It's not new. It's been done, but
so now the research, is there science behind this?
There's research. There is literally hundreds and hundreds of articles that the zygoma
show that it's effective.
Show the zygoma implants, along with the standard implants for fixed teeth, is the gold standard now for patients.
So the I don't have enough bone excuse?
I don't have enough bone excuse is out of the door now. Because when I see patients, they come to say, you know what, doc, I was told I don't have enough bone. I need to go through bone grafting. In back of our mind, we know that when we take a 3D scan on the patients, we're always going to find bone. Even if they don't have bone for a traditional all-on-4, we know after we take an evaluation and scan that they're going to have bone, so they're a good candidate for zygoma implants.
Okay, now we've talked a lot about, for the denture wearers, no more dentures, but a less expensive option is 2 implants for a snap-in, snap-out.
Yeah, it's a very good option for a lower denture. Now, lower dentures not even a standard of care anymore. So if somebody's going to lose their teeth or they have lost their teeth, I would say a minimum option is put 2 implants in the front part of the mouth and just lock the denture in. But you got to take the denture out.
But no more adhesive.
No more adhesive. No more messy adhesive, and no more embarrassment of.
They can eat and chew, whatever.
They can eat and chew. But the bad part about it is that the implants are only front part of the mouth. So you're losing bone in the back part of the mouth, and over the years, they're going to need to have constant relining and rebasing, and they're going to have to have those attachments changed. And guess what? The chewing force it's only up. It maybe 30,
so you
40,
like 4? You like 4 implants?
Yeah, 30–40% of chewing force is back, but with the all-on-4, where you're putting 4 implants through the jaw, specially placed, and you can fix all the teeth immediately.
So full arch of teeth.
Full arch of teeth. We're talking about from molar all the way to the front. We're talking about anywhere between 10 to 12 teeth.
And it doesn't hurt.
It does not hurt.
It's not something they're complaining about, we should say.
It does not hurt. It does not hurt, because most patients, they go back to work and resume normal lifestyle with very minimal to no discomfort.
Okay, so if somebody's watching this, they're wearing a denture, okay, or their whole teeth you know, like you say, a full mouth of teeth that are falling out or they don't know their options, they could go in and in one visit they could walk out with teeth.
Absolutely.
Is that right?
That is absolutely right.
I mean, ideally 2 visits, right?
After initial workup,
Okay.
after initial workup, when we do a full evaluation and get workup, we have the teeth available ahead of time.
So after that consult, so one consult, they come in and then they get it done, and that's it.
One consult, few pre-workup appointments, but in one setting and under one appointment, they're sedated, teeth out, or if no teeth, implants placed, okay, and that same day they're going to leave with fixed teeth, and they can chew.
And you say the common theme is that they all say they should have done this years ago.
And they come back for their follow-up. They said, you know what, I wish I would have done it sooner because I don't know what I was afraid of.
Interesting, interesting. So we're just about out of time, but we have time for a few more photos.
Yeah, I've got a few more that I really want to share with you.
Okay.
Here's a gentleman that comes in. I mean, look at his condition. Infection.
Wow.
Pus, bacteria in the mouth. Her teeth hurt. You know, this person when he came, just as we talked earlier, he didn't seem happy. He seemed angry, but he wanted a solution. And this is 20 years of not going to the dentist, 20 years of neglect, and he's very fearful. So he's a very active individual, but he does not want dentures. He does not want to end up with dentures. He wants, and he was told he's got bad gums, he's got infection, he's not a candidate for implants. But look what we did for him. Look what he looks like. I mean, he is smiling. He's not used to smiling like this, but look, he's smiling, and look how.
Okay. Look how it looks like a little bit of a forced smile there.
It is a little bit of it, but you know what? You had to get it out of him. But look how it's literally, he's healthy. Not only he's healthy in his mouth, but his whole body's healthy. The infection is out, and he's eating better, he's chewing better, he's smiling better, and everybody around him is happy as well. Here's another patient, young man, okay, young man, had trauma.
This is a young guy?
This is a very young guy. But you normally you wouldn't think so just because of the smile, okay? Had trauma, lost his teeth, and just didn't know what his options were. But look at him now, okay? Look what he looks like literally a week later.
Very nice.
Okay, a big change. You know what his chief complaint was? I want to eat a steak. I want to be able to bite into, and I want to be able to date again. Okay, and now he's doing all that. Here's another one. She hasn't been happy for a long time. Okay, she had deep infection into her gums and into her bone. I mean, there's literally blood and pus coming out of the teeth, but now.
So those teeth had to come out.
Those teeth had to come out.
So it's like dentures or dental implants.
Dentures or dental implants. That's it. There's no other option. Okay, conventional dentistry is not an option at this point. But this is her literally 2 days later.
Okay.
You can see she's smiling from ear to ear, and she's a very attractive
lady.
What
a difference
she was.
Just teeth make, I guess.
A smile is the number one. You know what? People notice your smile more than they notice your nose, your eyes, and your hair. And let me tell you, when she first came to us, she was so afraid she couldn't even sit for a consultation. Okay, she had to come back again with her husband, and she put her trust and faith and confidence in us. And she said, you know what? I've seen your ads for years. Why didn't I come to you sooner?
Okay, so she has what? Okay, so this is a full set of teeth. They don't come in and out.
They don't come in and out.
And she can eat and she can chew just like her regular teeth.
She can
like
eat.
4 implants on the bottom, 4 on the top?
4 implants on the top, 4 implants on the bottom.
Now, what about when I hear other guys that say, you know, Randy, I don't know, I think, you know, it's safer with 6 or with 8 implants. What is your response to that? That's some of the people that are skeptical with this.
That's a great observation. Research and science has shown that the success rate by putting 4 implants or you put in 6 is exactly the same. Here's what we do in our office. If somebody has the jawbone, okay, if somebody has jawbone, we call it bone volume, we'll put in 6, okay, we'll put in 7. But the patients that we're seeing don't have the jawbone volume. They have so much bone loss. They have the back part of the upper jaw have really dropped down because of the sinuses. You know, people lose back teeth first, and the back part of the mouth back part of the lower jaw has been resorbed or has been lost so much. For those patients, they don't want to go through bone transplant. They don't want to go through bone augmentation.
Does that still happen today? All the time?
It happens all the time. And the patients that I treat, they are the patients that were traditionally told that they're going to have to go through bone grafting surgery and multiple surgeries before they get their teeth. So the argument is that if the patient has bone volume and they've lost their teeth or are going to lose their teeth, we'll put in 6. But the research shows that with the all-on-4 versus the 6 implants in good bone, the success rate is exactly the same, which is 98%.
Now, speed. You're big on speed. That means they come in, give them the teeth the same day. We talked on the telephone. You say, and you say, I want people to know that, number one, they're a candidate if they've been told they don't have enough bone. But you also said speed. You know, we do things very quickly. Now, when you say that that's important, is that an issue elsewhere? Without being negative, I mean that what you do in a short period of time may take 9 months elsewhere. Does that go on?
Absolutely, it does go on. You know what? We're in a day of age where people want things faster. Okay, people don't want to wait. People want immediate gratification. But it's not about immediate gratification to get their teeth, but it's proven science and the research behind it that removing the teeth, placement of implants, and fitting of the teeth can happen all within the same day. It's nothing new.
So they're never without teeth? They're
never without teeth. I mean, think about it. Why should people be without teeth when we have the training, when we have the technology, and when we have the implants that allow us to transform their lives and they can leave with teeth the same day? You know, why go through expensive and extensive bone grafting procedures when it's absolutely not necessary? So these patients are getting what's absolutely necessary. It's minimally invasive, it's absolutely less costly, and they get their teeth immediately. They get their teeth there. They have teeth from day one. Let's put it this way. They have teeth from day one, so they're never without teeth, or they don't have to wear dentures.
Continuing education on dental implant. How often do you go to conferences? And what are the name of these conferences?
Continuing education is ongoing, and I'm a lifetime learner. I go to the International Congress of Oral Implantologists. I'm a diplomate of it. I also belong to American Dental Implant Association. I'm also a diplomate of that organization.
What does that mean to be a diplomate?
Diplomat is the highest distinction that you can attain through advanced training, through advanced credentialing, presenting your challenging cases, and just letting the organization know that I have a lot of training and background. And you know, it's advanced credentialing because it also puts confidence in patients' eyes. As this person has gone above and beyond what he or she may have thought in dental school, but he has extensive residency and training in the field of implant dentistry. So my continuing education never stops, especially when it comes to, I'm a lifetime learner. I'm constantly evolving, I'm constantly learning because protocols and techniques are changing just to improve patients' lives. So what worked yesterday is not going to work today or tomorrow.
Frequently asked questions for denture wearers or people that don't know their options. They think, you know, I guess they don't know their options. What do they want to know on day one when they meet with you? What do they ask you every time?
They want to know is, are they a good candidate, first of all? They want to say, in their application, they write down the truth. Okay, the truth means, am I a candidate? Am I not a candidate? Is this going to hurt? Okay, is it going to take multiple years as I've been educated about previously? Okay, so these are the most common.
Answer those questions then.
So, are you a good candidate? Well,
usually it's yes.
And usually almost all patients are good candidate, unless there's certain medical history. Do you want me to go over?
You could have a little bit of diabetes.
Yeah, you can have a little bit of diabetes.
Osteoporosis.
You can even have osteoporosis. And a lot of my patients have osteoporosis, and they've been on osteoporosis medication. But we have a test. We actually have a test that we have the patients take to see if they're minimal to no risk. So it's very predictable.
What's the oldest patient that you've
The oldest patient, 92 years old.
92.
92 years old.
Why would a 92-year-old want to do this?
Because she wants to eat and chew. That's why.
Okay.
She wants to eat and chew because she wants to enjoy her foods with her family. I mean, she's very active. Every time she comes, she always have 2 or 3 family members that come with her.
And a 92-year-old, statistically, I mean, is it, you know, more likely to fall out, these dental implants, than a younger person?
Absolutely not. Absolutely not. And it's unbelievable, Randy, that the patient she had amazing jawbone, that we were able to put implants.
Did she, the 92-year-old, did she complain about pain?
Very, very minimal.
Okay.
Very minimal.
Like just soreness.
Mine's a little soreness, so she had to take some Tylenol or some Advil the next day. But let me tell you, when she's come for her follow-up visit, she's like, you know what? My family told me not to do this for many, many years, and now I fought with them and I got this done. So now they should have said, you know what? Okay. We should have listened to you. That we should have let you have it done because you're much more happier. You're eating better. Her nutrition is better. I mean, she's smiling. She's very active. So age is not a factor. A lot of it. And that was one of my other questions that I get from patients. That, am I too old for this? I'm too old. I'm 60s. I'm in my 70s. I'm in my 80s. I should just live with dentures. Absolutely not. You don't.
So no more dentures.
No more dentures. Our office, by the way, in Chicago, the dental implant center is No Dentures Dental Implant Center. That's the
No
name.
Dentures Dental Implant Center.
Dental Implant Center.
Do the guys that make the dentures, they don't like you by any chance?
You know what? I don't know. I don't know.
But you don't believe in dentures. I mean, your goal is to wipe out dentures in Chicago.
Absolutely. You know what? Dentures, anything removable, was the way of the past. I mean, let's face it. It was
Okay.
it was 17th century technology. I mean, we're in 21st century. We're replacing. We're doing robotic surgeries in medicine. We're doing prosthetic arms and amazing things. Why are we putting plastic and acrylic in patients' mouth when they can have fixed implant teeth with the all-on-4 with 4 implants, and they can have all of this done in a short period of time? What took years can be accomplished in days. So why? Absolutely.
Do you think they're just skeptical or afraid of the dentist?
Either they're
because you say there's got to be thousands in Chicago, tens of thousands,
tens and
upper
thousands.
lower denture,
Absolutely.
and maybe it's cost. They're worried about the cost because they count all their teeth. Maybe.
That is actually very true. Most patients feel that they need to have an implant per tooth, but that is not true. Again, science and research have shown that as little as 4 implants properly placed, you can get full arch of teeth. Okay, and you can do it all within 1 day.
This is great stuff. We're out of time. Final message though: somebody watching this, and they're still afraid. They don't know their options. What do you say?
I tell them, don't wait. Call us. There's hope. We will provide you hope. We will give you a solution. If you've been told you're not a good candidate for implants, and if you've been told that you have infected gums and you are not going to be able to get implants, come see us. We will give you hope. We will give you your life back. We will give you your quality of life back. Call us. Come meet with us.
No more dentures.
No more dentures, and we start your journey with us, and we will see. We have transformed hundreds of lives. Same day.
All right. I want to thank you for coming to the show.
Always
a pleasure. Always a pleasure. Thanks for coming back on the program and flying out from Chicago here to California.
My pleasure.
You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, visit our website at wellnesshour.com. Put in Dr. Atcha or put in Chicago Dental Implants. You'll find him there. And for those of you on Twitter that would like to say a nice thing about what you heard on the show, it's hashtag Wellness Hour. For now, I wish you good health.